So if those 4 presentations aren't proof that what we're doing here in Scottsdale is meaningful, has direct impact for patients, and is leading the way, I think we can clearly state that you're seeing companies that bring healthcare right to the patient. You're seeing companies that spread globally from here in Scottsdale. You're seeing top-notch research and the next workforce being trained in academic disciplines that the next knowledge worker will need to be successful in the U.S. economy. And then you're seeing actual patient benefit every day via this translational medicine that's occurring here in Scottsdale. So what we're going to do is step into the questions and answers section, and we have some prepared questions for each of you. We'll start at the end of the table, even though you just gave the presentation. I guess you're still amped, so we'll do that. So Mark, one of the things that's fascinating about HonorHealth and what you're accomplishing there is people talk about bench to bedside all the time, taking discoveries that occur in research and making it turn into life-saving therapies for patients. What is it about Scottsdale, about Arizona, about being the premier healthcare institution here, providing translational medicine in the way that you do, that makes you feel that Cure Corridor and everything that we're all doing here with you is the place to be? What are the things that you also want to see over the next 5 to 10 years occur here that will help HonorHealth and what you're doing spread out to the rest of the world?
Chris, thank you. That's a terrific question. And Scottsdale has really been an attractor to people like me and people like Dr. Von Hoff, who have worked in some of the largest and most successful universities and institutions around the country, and have appreciated the opportunities there, but have also been frustrated by the bureaucracies, by the difficulties in translating and moving ideas into action. I used to joke that my job as a medical school professor was to write papers for my 11 closest friends around the country. And I wondered whether that work was really having the impact that I wanted. And so what attracted me from the beaches of San Diego to the deserts of Scottsdale was what I saw as a collaborative community. I saw a hungry community that was building and vibrant on the new technology and the level of talent that you're seeing on this stage today, and what the stories that we've heard about. And we've seen a group that really wants to make a difference in the quality of life for our patients in our own community, and would not settle for being second best or accepting status quo. Those forces, I think, brought together to make this difference and be able to focus on driving results that have a real difference here. We've set out then a mandate for ourselves of trying to reduce and eliminate bureaucracy and obstacles to motion. And between that and the collaborative spirit and the ability to derive those collaborations, we've now become the kind of a destination where companies and others seek us out to get things done that they frankly can't get done elsewhere. For us to be successful in the next few years, I think we need to continue to build on that level of collaboration. We need to continue to invest in our future of developing talent so that we have that critical mass. And that's where you get that exponential growth in opportunities that feed back into better quality of life for all of our community.
Thank you, Mark. Dr. Runger, you're next. We are very fortunate to have had some interns this past semester from your department. I have to say they're all fantastic, stellar students. They display the kind of qualities that I was in San Francisco for 10 years before here, and you know, they can absolutely go toe-to-toe with the students that I've seen coming out of universities there. Dr. Runger, do you think that the way to Scottsdale building upon our growth and our leadership here in translational medicine, do you think that the students that you're training have the core skills and are ones which we can somehow convince to stay and to help us grow our community and our businesses here before they go off to, you know, the other destinations that they often end up at?
Okay, thank you, Chris. The information technology in healthcare is such a big driver for the improvements, just like it's had enormous impacts in other fields and disciplines and so forth. And so I think that a trained workforce is critical, to make the kind of advancements that we're looking to make. To move the center of mass of healthcare and kind of bend the cost curve, those information technology components are just big inputs into that system. We have to deliver knowledge efficiently. We need the semantic interoperability of our data, right? So we can't just fax things around in a sense. We have to have more understandable type relationships between all of our data structures. And so those efficiencies need sort of that workforce skill set that we're trying to build. I know it's important because it's very difficult for us to place all the requests we have for internships and jobs. There are so many opportunities for the students that our biggest challenge is getting the word out into the high schools, into the undergraduate students about how good this job market is and how important this field is for advancing healthcare. And so I appreciate the opportunity to come here to kind of let folks know that the programs exist and the career paths are excellent. And so I think that workforce is going to contribute towards the development areas within Scottsdale, entrepreneurial as well as the existing organizations in both research and delivery of healthcare. I regret to say our last 2 PhDs last year were both hired by Google. Fortunately, they'll still be doing work in healthcare, but not within Scottsdale. So I think the next step is to not only make them as competitive as they are nationally, but then keep them locally engaged.
Great. Thank you, Dr. Runger. So Joel, here and in Africa, you have 2 physical locations. Your business is one of the, kind of unsung heroes, I would say, of Arizona. You've been at this for 14 years. Long before the Cure Corridor concept was born from Mayor Lane's office, but your success and your spread of your solution globally, I think, speaks to the opportunity to grow businesses here in Scottsdale and grow things from Arizona that everyone can benefit from. So what do you think we need to do as a community, as the Cure Corridor, to deliver that cure, to deliver things to the patient in a more efficient and technologically based level? And Africa, tell me more about that.
Yeah, thank you, Chris. We've got a wonderful environment in Scottsdale. With being in 50, 60 countries around the world, most of those partners that we have in those countries, or even their medical professional staff, come to Scottsdale. And I will tell you, several have bought homes here because it's like no other place on the planet. And they love going up north to Sedona and to Flagstaff. But the workforce that we have, the talent that we have in Scottsdale for our company with software engineers, hardware engineers, industrial designers, cloud architects, mobile app designers is actually very good. We're very pleased with with the caliber of individuals here in Arizona, and especially up where we are. And it's really nice too in Scottsdale because we pull from around the valley for our workforce to come in, and they like it. I mean, especially where we're located next to the core of the restaurants, all that plays a part of the quality of life that we have here in Scottsdale. So I think the mayor and his team and the chamber has done a great job, and so there's not a whole lot I would change there. For us around the world, though, we have pretty good care here in Scottsdale, as from HonorHealth and others. In other parts of the world, it's our mission. We could focus more on just our local environment, but we really believe the access issue is global. And so the applications that we're designing are designed really to help more people. We have the vision has been for years, quality, timely care for all, no matter where they are. And for us as a company to be serving our U.S. veterans, which has been such an honor. I'm a U.S. vet, and so to serve them, and think about this, the same technology that is in Elkhorn, Utah, providing the best doctor to that patient is the same technology that the White House uses, with very little modification. There's a little bit more jamming equipment where they are. And so we have to continuously develop to fit our market. And the products that we've developed for the U.S. and a lot of the industrialized world they don't work in Africa. And so we've had to redesign and bring the touch points of care everywhere.
Great. Thank you, Joel. Okay, Andrew, you've been the quietest so far. We're going to ask you perhaps the hardest question, which is, you had your choice of forming your company and establishing headquarters anywhere. Once you had your Series B, congratulations, by the way, you could have been in the Bay Area, you could have been anywhere. Why Scottsdale? And thinking of all this stuff going on, and as an entrepreneur, and you're going to make your business grow and succeed, what do you want to see from the Cure Corridor that will help you succeed, help GoBiquity succeed, and really drive your business forward?
Yeah, I thought this was a 20-minute Q&A, so it's actually it's exciting to be here. But I have to say, in January of 2015, I sat with our investors and the board of directors, and they said Scottsdale, and it was quiet. And that's really probably an answer that a lot of companies will have when they initially say it. And it's not because of anything negative here. It's an unknown. And I think that's where I take it to January of 2016. That same group of investors, they said that was the right choice. And that was exciting that they came and said that, but it was more of the traditional venture capital model where those organizations are looking really for the norm, the same blueprint, and what's successful before will work again. So we did change it. We did identify Scottsdale. There were a lot of reasons, a lot of good reasons why we came here. First of all, I think as you can see here, you have such a mix. There is actually and this is kudos to the city of Scottsdale, there's actually this ecosystem that is encouraging collaboration, and it's actually trying to learn from others, and not just in terms of the experience that you're having, but how to go out and hire, what markets to find, what office location should I go to. And those are little things that you can take for granted that when you're in an early stage company, you're actually not wanting to be burdened with that level of commitment where you're distracted by that. Now, at the same time, what I was excited about coming here is this is a very favorable business environment when you think about the operating costs. It's also a business environment that actually has a strong healthcare expertise. It may be more legacy in terms of the larger companies that are here, but that's actually very attractive, and that's a knowledge base that wasn't existing in the Bay Area, the Boston area. That was more biotech in Boston area, more digital tech in the Bay Area. So that was attractive. Now, at the same time, there's still some areas where I know Scottsdale has to improve. And it's not where we say the city of Scottsdale has to improve, it's us as the constituents, where we have to encourage academia to improve upon the development community. We are having a significant challenge around software development, and it doesn't happen overnight, and we have to be accepting of that. But you really do need to create that culture. That's why the Research Triangle, that's why the Bay Area are so successful, is they have strong academic commitment and the students that come out. At the same time, it's also, we want to continue to make this an attractive area. I'm really excited about what Scottsdale is doing from a social perspective. It's more of a city. It's more of a feel where there's an all arts, greater arts and culture. And that emphasis is important because that audience, that target population that we're trying to hire wants that. They want to go hiking. They want to go out at night where they can actually have a chance to learn and socialize. And that's something that I think Scottsdale is doing a much better job at, but it has to be continued to grow because that's important where they're not here just to work. People aren't here to work. We don't want them to go to San Francisco. We want them to stay here. So it has to be really a full city commitment.
Great. Thank you, Andrew. Mark, George, Joel, Andrew, thank you so much for your presentations. Thank you for the Q&A. I think I'm out of time, unfortunately, but please thank the speakers with me.